welcome to Hendricks Regional Health. Your doctor has ordered a cardiac catheterization, also known as a heart cath. The goal of this procedure is to evaluate the quality of your heart function and heart vessels. Your doctor will talk to you about the procedure, but here's some more information about what you can expect. Prior to having your procedure, you will be required to have some pre-admission testing, which will consist of having some routine blood testing as well as a 12-lead EKG of your heart. Please bring all of your current medications in their prescription bottles with you the day of your procedure. Your physician will tell you which of your medications you should take the morning of your procedure. Please do not eat or drink anything after midnight the evening before your procedure. For safety, you will not be allowed to drive for 24 hours after your procedure. It is important that you have someone with you to drive you home and stay with you the night after your procedure. Expect to spend 6 to 8 hours at the hospital for the procedure. If you have a stent placed, you may need to spend the night. Pack an overnight bag with any necessary belongings and personal items you may need. Please arrive at the designated registration desk at your scheduled time. You will be escorted to the cardiac cath lab waiting room. There's a TV and Wi-Fi available for your family members. On the day of your procedure, you will be taken to the pre-post area to get ready. Here you will meet the cath lab staff. They will ask a few more questions to recheck your health history and review your current medications. You will also sign a consent form. You will be given a hospital gown and be asked to remove all of your clothes, including undergarments and jewelry. The cath lab team will monitor your blood pressure and heart rate. We will also start an IV, which will be used to give you IV fluids and medications during your procedure. A little warning, we will have to shave your wrist and groin area to prepare the potential sites for the procedure. Possible sites include the radial artery in the wrist or the femoral artery in the groin. It will take about an hour to prepare you for your procedure. Next, you will be brought into the cath lab. You will be in here for about an hour to an hour and a half. It is important that you are able to lay flat on the table. A sterile drape will cover you during the procedure. This is a sterile environment, so you must keep your arms under the drape at all times. During the heart catheterization, your cardiologist will insert a sheath, which is equivalent to a large IV into an artery in the groin or wrist. Your cardiologist will decide which access site is best for you. A long, thin tube called a catheter is inserted through the sheath. Contrast dye is then injected through the catheter, which highlights the vessels in your heart and allows your doctor to visualize any blockages and evaluate your heart function. You will be given medications that will help you relax. Our goal is to make you as comfortable as possible. Your cardiologist will numb the access site prior to inserting the sheath. You may feel pressure at the access site. Most people tolerate this procedure with minimal discomfort. If you experience pain, please let a member of the cath lab staff know. If you have any blockages, a physician will determine whether a stent should be placed. Most people are awake for the procedure but given medications to help them relax. Placing a stent typically takes about an hour or an hour and a half, but can vary by case. A special catheter with a balloon and stent will be inserted through the sheath. A stent is a small metal coil or mesh that is used to enlarge the passageway to allow blood to flow to the heart muscle. The stent is positioned at the side of the blockage within the artery. The stent balloon is inflated and the stent expands to push back the plaque that is obstructing the flow of blood in the artery. The stent will remain in your artery permanently. During this part of the procedure, the nurse will give you additional medications through your IV and by mouth. After your procedure is complete, the sheath will be removed, which will take place either here in the cath lab or in the holding area. For femoral or groin access procedures, manual pressure may be applied or a closure device may be used. This decision is made by your doctor. If the radial artery access is used, a transradial or TR band is placed on your wrist. This clear plastic bracelet maintains light pressure over the radial artery. The nurse and technologist will keep you updated as to when you will be discharged or taken back to your hospital room. If you are scheduled to go home the same day, you will be staying in the pre-post holding area for 2 to 4 hours. This depends on the access site and if a closure device was used. You will be monitored closely at this time, paying close attention to your vital signs, access site, dressing, and your pulses. It is important to let your nurse know if you have any bleeding or oozing from the procedure access site. You will be shown how to hold pressure to the site if bleeding were to occur. Expect to spend 4 to 6 hours at the hospital the day of your procedure. If you have a stent placed, you may be asked to stay the night in the hospital for observation. A nurse will go over your discharge plan with you that will include your limitations, diet, activity, medications, follow-up appointments, and when you should contact your doctor. It is important to have someone ready to drive you home and stay with you the night after your procedure. Due to medications used during the procedure and the risk for bleeding, you will not be allowed to drive for 24 hours after your procedure. Results of your procedure will help your doctor to identify your specific problems and recommend the best treatment. This may include a change in lifestyle, diet, exercise, or new medications.